COVID-19 pandemic has been the biggest shock ever suffered by the world's public health services. Almost every national health service was overwhelmed, and few coped well with the pandemic in the early months. The only exception was the extremely efficient and well-funded German National Healthcare Service. But even as the world's health services struggled to cope with the pandemic, one clear major global trend was emerging. Disease mitigation and social distancing demanded that wherever possible, healthcare should be accessed and delivered remotely. This has led to a hugely increased use of telemedicine, artificial intelligence and digital consumer health apps to deliver to remote health consulting. Even new virtual hospitals have been opened. Taken together, these technologies are known under the umbrella title digital health. The ultra-conservative medical profession has been catapulted into the digital era, and healthcare delivery will never be the same again. In the USA, Medicare and other health insurers have long refused to pay for telemedicine and other digital health devices. The pandemic forced these insurers to provide insurance coverage to include payments for telemedicine consultations and other digital health procedures. Following this change, the number of telemedicine consultations jumped from 11,000 a week to over 600,000. And the ridiculous US law that requires physicians to hold separate medical licenses for each state they work in was suspended. This allowed doctors to provide phone or digital consultations from all around the country. These ludicrous and job-protecting closed-shop restrictions are unlikely to be reintroduced. In managing the pandemic, South Korea immediately integrated digital technology into its government-coordinated containment and mitigation process. This included public surveillance, testing, contact tracing and strict quarantine. This huge digital health initiative led to the nation suffering far fewer deaths per capita than almost any other nation state. Australia was another nation that was refusing to pay physicians and hospitals for remote digital health services. This policy has now been reversed and is unlikely to be reintroduced. There is now a virtual hospital operating in Sydney, and the adoption of digital health in Australia has been described as the most far-reaching change for general medical practice in a generation. After the pandemic struck, India's federal government rushed to finally deliver long-delayed guidelines for telemedicine practice. Since the guidelines were published in April 2020, the number of teleconsultations in India has been doubling every week. In France, there has also been an explosion in digital health communications. Apps including Dr. Liv, Medivis and MedDoctor are now a major part of public health delivery. Germany's outstanding success in managing the COVID pandemic is partly due to the government's long-term support for digital health. In November 2019, the government parliament passed the Digital Supply Law, which enables doctors to prescribe digital health apps to patients. The law also allows the country's statutory health insurance scheme to reimburse the costs of telemedicine and digital health. And German online chatbots have also been answering the public's question about COVID symptoms. After analysing the user's input, the chatbot provides a risk assessment and even the option for a telemedicine consultation. In the UK, the government has mandated that all initial primary care and outpatient consultants should be done by telemedicine. This initiative is known as Digital First, and physical GP consultations fell by 70%. Traditional UK hospitals have not dealing directly with COVID to turn themselves into virtual hospitals. In addition, Britain's National Health Service also offers an online chatbot for initial COVID-related consultations. So what will healthcare look like when this pandemic is finally over? Most of the early reports suggest that the world's sudden mass experiment with digital health has been a resounding success. Even amongst patients suffering with mental health issues, there has been a 70% approval rating of treatment delivered by telemedicine. Of course, there are two main worries with remote consulting, whether by apps, phone or video link. The first is misdiagnosis. Health professionals undoubtedly will require additional training in telemedicine and digital health to reduce this risk. AI systems will have an important role in developing this training. They are transcribing and analysing millions of remote consultations, learning how different humans describe their symptoms and how they interact with medics remotely. In addition, the EU is introducing new medical device regulations in May 2021 to ensure the accuracy and quality of digital health equipment. The second big challenge for digital health is data privacy. It is vital that medical records are not exposed to hacking, and every app, internet connection and wearable device must be super secure. But the benefits the world's health services stand to receive if there's even a partial switch to digital health and telemedicine are enormous. I am confident that a majority of medical professionals and patients will continue to use telemedicine and remote monitoring when the pandemic is defeated. Digital health is the one big winner from the pandemic, and it may turn out to be the saviour of our overstretched public health services.